Back in this country, the Delta variant continues to surge. For the first time since February, the U.S. is averaging over 100,000 new infections a day. One of the places hit particularly hard is Missouri, where right now only 42% of eligible people are fully vaccinated. In the last 7 days, Missouri has recorded more than 20,000 new cases. I'm joined now by a Republican who has been very public about his vaccination and is urging others to do the same. Representative Billy Long represents Missouri's 7th congressional district. He's also running for the open Senate seat, being left by Senator Roy Blunt. Congressman Long, great to have you on the NewsHour. Could you just give us a sense of how things are in Missouri right now? How are your hospitals doing? How are cases doing?
In Springfield, where I am, the hospitals are having a really tough time trying to keep up. They're trying to transfer patients to other locations, even have a little issue with that. I know that one hospital here had 11 folks deceased since Friday evening. And so it's pretty dire situation right now. I will report, I heard you give the statistic there about 42% of Missouri. Springfield has hit up over 50% now, which is a very good trend. I think that a lot of people are reassessing their position on the vaccine and deciding that they see these folks in the hospital and they see the sad stories about people on their last breath saying, I wished I hadn't said I wouldn't take it for a year. I was going to wait a year and now it's too late. And then that person will decease a day or two later. So I think people are really starting to understand how important it is to do what I did. Is what I tell people. Go to your doctor. As soon as I was eligible for the vaccine, I went to my doctor and I said, hey, you know my medical history, you know everything about me. Am I a good candidate for this vaccine and should I take it? And the doctor said, you're a very good candidate for the vaccine. So I took both doses, of course, of the Pfizer vaccine is the one that I took. My wife has had the vaccine. Both daughters have had the vaccine.
On this issue of the sort of misinformation and disinformation and mistrust that is out there, you have been, as you were saying, very public in celebrating getting this vaccine. You've encouraged others to do it. Do you think that if President Trump had done the same, if he, when this vaccine came out, if he had said, this is the safest vaccine. It's one of the great successes of my administration. I want you all to watch me to get the shot, and then I want you to do the same. Do you think that would have helped change some Missourians' minds about this?
I don't know. The main people that didn't want the Trump vaccine were the Democrats at the time. If you remember, even before it came out, they said, well, Trump's developing it. We think he's doing it too quick. I think all politics should be removed from this. It's ridiculous to me to bring politics into this life or death situation. Trump did what no one has ever done before and brought a vaccine to the market rapidly. He took the vaccine immediately. And I think that the making it a political football is just repugnant to me. And I think that everyone should operate, at whatever level they're comfortable with, whether they, like I say, check with their doctor. I had a guy today contact me and he asked me the same thing about where I was on the vaccine. And I read all these different reports and I see this and I see that. And I really don't know what to believe. And I suggested he check with his doctor and do as I did and take the vaccine if his doctor recommended it. And he wrote back and told me of some situations, things that his doctor wasn't real sure if he should take it or not. And I said, hey, that's why I told you to go to your doctor. I'm not a doctor. Don't come to me. But, that's just my advice to everyone.
I mean, I hear what you're saying, though. Their vaccine hesitancy is disproportionately high amongst GOP voters. But moving on for a second, we have seen mandates started to come out. Businesses, state and local governments have been coming out with mandates. Do you think that that's a good idea? Could that get these numbers up and could that help save lives?
I don't know if it would help get it up, but I'm not for mandating putting a needle in anyone's arm, period. I don't think that that's a good way to go. I think the best way to go is encourage people and show them what happens to the majority of the people that are vaccinated, how it's a good, safe vaccine, and to take the vaccine. But mandating anything in the United States of America in a free country, I don't think should happen.
Well, we do mandate certain things. I mean, for kids to go to public school in Missouri, they say you're basically required to have the measles, mumps, rubella vaccine. You don't think in this case that would be a smart thing? I mean, schools are going to reopen in a couple of weeks.
No, I don't. I'm not for mandating vaccine. No, I'm for encouraging people to take the vaccine, but I'm not for mandating it and making people put something in their body, against their wishes.
All right. Representative Long, best of luck to you in Missouri. Thanks very much for being here.
Thank you, William. Appreciate the time.